somewhere in the world right now, a child is being vaccinated. That single moment, repeated billions of times across history, has saved more human lives than almost anything else ever invented. Smallpox alone killed over 300 million people in the 20th century, more than both world wars combined. Today, smallpox is gone, completely erased, the only human disease ever fully wiped from the face of the earth. So who made that happen? And why does history credit one man, when the real story starts 75 years earlier? Today we ask, who invented the vaccine? To understand why the vaccine mattered, you need to understand what smallpox actually did to people. It killed between 15 and 45% of everyone it infected. Those who survived were often left permanently scarred or blind. In the 18th century, smallpox was killing 400,000 Europeans every single year. Royalty, peasants, soldiers, children, it didn't care. It moved through populations like fire through dry grass. The only known protection was to have survived it yourself, which meant most people were permanently afraid of it. Until one woman changed that. Her name was Lady Mary Wortley Montagu, and someone who knew exactly what smallpox could do. She had survived smallpox herself in 1715. It left her face permanently scarred. Her beloved brother had died from it. In 1717, her husband was appointed British ambassador to the Ottoman Empire. She moved to Constantinople, modern-day Istanbul, and there she discovered something extraordinary. The local population had a practice of deliberately giving people a mild version of smallpox to protect them from the deadly one. They called it variolation. A small scratch on the arm, a tiny amount of material from a mild smallpox case, a few days of mild illness, and then permanent protection. Lady Montagu was so convinced she had her own son inoculated in Constantinople in 1718 by the embassy doctor. When she returned to Britain in 1721, smallpox was raging through London. She had her daughter inoculated, the first such procedure ever performed in England. She then campaigned publicly for inoculation, writing articles under a pseudonym, lobbying the royal family, even persuading the Princess of Wales to have her own daughters inoculated. The medical establishment hated it. They called it dangerous, but variolation spread anyway. By the time Edward Jenner was born in 1749, it was already an established, if controversial, practice in Britain. Edward Jenner was a country doctor in Gloucestershire, England. As a child, he had been variolated himself, in the old, risky way with actual smallpox material. It had left him very unwell for weeks. Years later, working in the countryside, he kept hearing the same thing from local milkmaids and farm workers. Catch cowpox, and you'll never get smallpox. Cowpox was a mild disease. It gave milkmaids blisters on their hands from contact with infected cows. It wasn't dangerous. It passed quickly. But those same milkmaids never seemed to catch smallpox, even when everyone around them was dying from it. Jenner had a hypothesis. What if cowpox, the mild version, could be used to protect against smallpox, the deadly one, without the risk of variolation? On the 14th of May, 1796, Jenner put that hypothesis to the test. A local milkmaid named Sarah Nelmez had fresh cowpox blisters on her hands, caught from a cow called Blossom. Jenner took fluid from one of Sarah's blisters. Then, he scratched it into the arm of an 8-year-old boy named James Phipps. James developed a fever for a few days. A small blister appeared where the fluid had been scratched in. Then, he recovered completely. 6 weeks later, Jenner did something that no ethics committee in the world would allow today. He deliberately exposed James to actual smallpox. James Phipps did not get sick. Jenner tested him again, multiple times, with smallpox material. James remained completely protected. Jenner named his discovery vaccination. Jenner tried to publish his findings in the Royal Society's journal. They rejected it. The evidence, they said, was insufficient. He published his findings himself in 1798. The public reaction was a mix of curiosity and horror. Some people were convinced that injecting cow disease into humans would make them grow cow parts, but the results spoke for themselves. Wherever vaccination was introduced, smallpox deaths fell sharply. By 1803, Jenner's findings had been translated into French and Spanish. The King of Spain launched a global vaccination campaign reaching the Americas and the Far East. Napoleon, who was at war with Britain, vaccinated his entire army and declared Jenner one of the greatest men in history. He released British prisoners of war at Jenner's personal request. For nearly 2 centuries, vaccination slowly pushed smallpox back, country by country, continent by continent. In 1967, the World Health Organization launched a global campaign with one specific goal: eradicate smallpox completely from the face of the earth. Teams of health workers fanned out across the most remote corners of the world, tracking every case, vaccinating every contact. The last naturally occurring case of smallpox in the world was recorded on the 26th of October 1977 in a cook named Ali Ma'omalin in Somalia. He survived. And on the 8th of May 1980, the World Health Organization made the official declaration: smallpox was eradicated, the only human disease ever completely eliminated, gone forever, because of a cow, a milkmaid, a country doctor, and an 8-year-old boy. So who invented the vaccine? All of them made that. History remembers the scientist, but now you know the full chain.